Bismillahirrahmanirrahim. Welcome to my new lecture. This is lecture number 19. In this lecture we will talk about the phenytoins. What is phenytoin? As we know that phenytoin, so it comes under the category of anti-epileptic drug or anti-conversion drug. So phenytoin is actually diphenylhydantoins. Phenytoin, actually this is anti-epileptic drugs. The most commonly used drug that is called phenytoins, and it is used in the treatment of epilepsy. The mechanism of action of phenytoins, it can prolong the inactivated state of voltage sensitive neuronal sodium channels and reduce the neuronal excitability. If you remember, in our previous lecture we have already discussed that there are most of the anti-epileptic drugs, so they can block the voltage gated channel sodium channels for the purpose of to stop the excitability and the actually the abnormal discharge from the brains. So in this case, actually phenytoins, it can prolongs the inactivated state of the voltage sensitive neuronal sodium channels, as well as it reduces the neuronal excitability. Moreover, the pharmacokinetic profile of phenytoin is, the absorption is actually formulation dependent. The absorption of phenytoin is formulation dependent. It is highly bound to the plasma membrane and to the plasma proteins. So as already, if you remember, so I have in my previous lecture I have already discussed about the plasma protein, that how the drug can receptor with the what is free form of a drug and bound form of a drug. Is already in the previous lecture I have mentioned all these things. So these are highly bound to the plasma protein, like fosphenytoin. Fosphenytoin, actually it is available for the IV and IM route. The kinetics changes from first order to 0 orders over the therapeutic range. If let's suppose if small increase in the dose or small increment in the dose, it will produce disproportionately high plasma concentrations. So already you can check my lecture number 13-14, which I have already explained the overall parameter of zero order kinetic and first order kinetics, that how the rate of reactions is increased whenever the concentration of the drug is increased or decreased. So I have already discussed all these things in my previous lectures. What is zero order kinetic, what is first order kinetic. So must review these lectures. Inshallah, each and everything will be clear to you peoples. So if small concentration or small increment in dose produce disproportionately high plasma concentration, the half-life of phenytoin is 12 to 24 hours. So it is the time which is taken by drug to achieve the peak plasma concentration to be reduced 50% half of its original concentration. So it means that with the passage of time, in a certain period of time, after 12 to 24 hours, the half-life of the drug, it will be decreased from 100 to 50%. It will be reduced half of its original concentration, which I have already discussed in half-life of the drug. So the half-life is 12 to 24 hours progressively, so it can increase up to 60 hours when the plasma concentration rises about 10 micrograms per ml as metabolizing enzyme gets saturated. So this is the pharmacokinetic profile, that how the drug is metabolized, how it can absorb and how it can be eliminated from the body, and how it can transfer, how it can be transferred from one place to another place in your body. Okay, now come toward the adverse effects which are reported by the literature review. So here these are the adverse effects which are reported after the administration of phenytoin at therapeutic level. So the adverse drug reaction which are reported, they may be in the form of gum hypertrophy. So look at here, this is gum hypertrophy, or you can say gingival hyperplasia. So these are the ADR, adverse drug reaction, which are reported after administration of phenytoin. Look at here, hirsutism. So you know hirsutism, this is another abnormal condition in which they you can say abnormal hair growths. So hairs, they are abnormally develops, especially in female. These are the adverse effects which are reported. Adverse effect may be in the form of hypersensitivity reactions. There may be chances of megaloblastic anemia, osteomalacia, and hyperglycemia, increased glucose concentrations. Fetal Hydention syndrome, hypoplastic phalanges, cleft palate, hair lip, microcephaly due to its you can say due to its orange you can say or the new its oxides metabolites. So after that, these are the look at here. These are the adverse effects. These are the adverse effects which are reported. So at high plasma level, the dose-related toxicity and central nervous system, it causes cerebral vestibular manifestations, ataxia, shaky moment, and you can say vertigo, diplopia, blurred vision, nystagmus are the most common feature or characteristics. Drowsiness may be occur, behavioral alternations and mental confusion and hallucination. These are the adverse effects which are reported in the literature. And gastrointestinal tract, it causes epigastric pain, nausea and vomitings, and it can be minimized by taking the drug with meals. And the cardiovascular system, there may be chances of hypertension and arrhythmia. The clinical uses of the phenytoin. So phenytoin, this is one of the most effective drug which is used in the treatment of epilepsy. So it is also used in generalized tonic-clonic seizure, simple and complex partial seizure. It is ineffective and absent seizures. So actually this is ineffective in the absent seizure. The dose, the normal dose which is available, so the dose is 100 milligram BD twice a day. It can be given to the patient. Maximum up to the dose may be increased according to the condition of the patient. So its maximum dose 400 milligram per day. And children, the recommended dose is 5 to 8 milligram per kg body weight per day. So on the basis of per day, status epilepticus occasionally used by the slow IV injections and trigeminal neuralgia. So it means that phenytoin is also used in the treatment of trigeminal neuralgia, which is the second choice drug to the carbamazepine. Mean that after carbamazepine, phenytoin is the second choice drug which is used in the treatment of trigeminal neuralgia. Another drug that is called carbamazepine. So the same mechanism of action, it can block the voltage gated sodium channel blockers. While the adverse effects which are reported here, so dose related neurotoxicity may be occurs in the form of sedations, dizziness, vertigo, diplopia, blurred vision, ataxia, vomiting, diarrhea. Acute intoxication may be occurred in the form of coma, convulsions, and cardiovascular collapse may be they are also reported. So hypersensitivity, this is another antigen antibody reaction. Rashes may be developed, photosensitivity and hepatitis, lupus-like syndromes they are also reported. And the adverse drug reactions, water retention may be occurred, the water become retained, and the hyponatremia may be occur in the elderly patients. So it enhances the ADH antidiuretic hormone actions, as well as it also cause teratogenic effect, developmental abnormality. So as we know that the clinical uses of carbamazepine, so carbamazepine actually it is the most effective drug for this central pain syndrome. You know, this is the first choice drug with phenytoin for generalized tonic-clonic seizure and stiff person syndromes. Another clinical indications of the carbamazepines, which is available in the market by named Tigrals, trigeminals and other related neuralgia is a drug of choice. Manic depressive illness and acute mania is an alternative to the lithiums. Now come toward another anti-epileptic which is called ethusuximide. So ethusuximide, this is another drug, and this drug, the mechanism of action of ethusuximide, it can inhibit the T-type calcium channels, calcium currents which is produced in the thalamic neurons, which I have already discussed in my previous lecture about the T-type calcium current which is produced and the thalamic neurons. The adverse effects which are reported by the literature, that is GI intolerance. There may be a tiredness, mood changes, agitations, shakings, headache and drowsiness and inability to concentrate. The person become unable to focus on a something. For example, if someone is, it means that he couldn't maintain his body equilibrium. The clinical indication or clinical use of ethusuximide, it is only used under treatment of absence seizure, but use has now declines as many consider valproic acid to be superior to it. Nowadays we know that Ethereum, you can say sodium valproate or valproic acid, it is much superior. So due to use of and due to its efficacy, the use of the ethusuximide, so they are declines, they are reduced, and only they are used in the absence seizures. So another important drug that is called valproic acid. So valproic acid, it is available in the market by a trade name sodium valproate. So there are multiple mechanism of action of anti-epileptic drugs. So valproic acids, what is the mechanism of action? So the mode of action, mechanism of action of valproic acid is just like phenytoins, like frequency, it is dependent on prolongation of sodium channel and activation. So our main focus is how to inhibit, how to prolongs the frequency by blocking the sodium channel and activations. Okay, so as I was talking about the valproic acid, so there will be a decrease of calcium mediated T current. Ethusuximide, like another mechanism is it can increase actually the release of inhibitory transmitted, that is gamma aminobutyric acid, by inhibiting its degradation by GABA-transaminase and by increasing its synthesis. So this is very simple mechanisms which I have already discussed in my previous lectures. The clinical indications or uses of valproic acids according to different literature reviews. So it is highly effective in the absence seizure, myoclonic and atonic seizure. So it can its control is after incomplete, but it is a drug of choice. They are also used in the treatment of mania and bipolar disorders, is alternative to the lithium salt. The adverse effects which are reported, let's suppose in case of overdosing, let's suppose if overdosing occurred, if you are going to exceed the concentration of the drug, so if valproic acid, so these are the adverse effects which are reported in the form of anorexia, loss of appetite, vomiting, loose motions may be occur, and heartburns, as well as drowsiness, ataxia and tremors. So these are reported. Alopecia may be occurs, and curling of the hair. Alopecia, and where there is, you can say, the particular area, especially of your head region, there loss of hair from the particular area of your you can say your head regions. Curling of the hair increase the bleeding tendency, there may be chances of bleeding tendency. And another adverse effect which is reported by the valproic acids, that is fulminant hepatitis, which is very rare. So fulminant hepatitis, actually the liver become unable to perform their function, and the liver it become quickly fail to perform their normal physiology. Pancreatitis may be occur, inflammation in the pancreas, high incidence of PCOD may be occur, especially in female. Polycystic ovary syndrome may be occur in young girls, and teratogenic effect, they are also reported by different literatures in case of overdosing of valproic acids. Another anti-epileptic agent that is called Lemotrigine. So Lemotrigine is another anti-epileptic drug. So the mechanism of action of Lemotrigine, it can block the sodium as well as the high voltage dependent calcium channel. The clinical uses of the Lemotrigine, this is broad spectrum anti-epileptic agents. Its refractory cases, the refractory cases of the partial seizure and GTCS, they are also reported, as we have already discussed in our previous lecture. Absence and myoclonic or akinetic epilepsy types, so they are reported, they are also used in the generalized GET, mean generalized tonic-clonic seizure. So they are also used in the treatment of generalized tonic-clonic seizure. They are also used in the treatment of absence and myoclonic or akinetic epilepsy, and as well as they are used under treatment of Lennox-Gastaut syndromes. The adverse effects which are reported by different literatures, if overdosing of Lemotrigine can occur, adverse effects they are reported. So there may be sleepiness, dizziness, diplopia, blurred vision, ataxia, and vomiting. Better tolerated than Carbamazepine or you can say Phenytoin. Rashes may be occur, hypersensitivity reactions. So there are some areas which are very complicated. So especially in that case, you will have to this drug can be used with precautions. So gabapentin, this is another anti-epileptic drug. So what is the mechanism? The mechanism of action of gabapentin. So it can enhance or increase the GABA release, gamma aminobutyric acids. So it can increase the gamma aminobutyric acid release in the brain. So it doesn't act as agonist at the GABA receptors. It reduces the seizure frequency and refractory partial seizure with or without generation. They are effective in stiff person syndrome, and as well as these are the clinical uses. They are also used in the treatment of manic depressive illness and migraine. So it is the first line drug for the pain, especially in diabetic neuropathy and you can say post therapeutic neuralgia. The adverse effects which are reported if gabapentin is used, so it may cause mild sedation, tiredness, dizziness, and sometimes cause unsteadiness. Vegabetrin is another anti-epileptic drug, and this drug, the mechanism of action of vegabetrin, so it can inhibit the GABA-transaminase, which is the name of the enzyme which can degrade the GABA, gamma-aminobutyric acid. So actually vegabetrin is effective in refractory epilepsy, especially in partial seizure with or without generation. The clinical uses, they are used and the treatment of partial seizures. Very simple. The adverse effects which are reported after the administration of vegabetrin, so these are there may be chances of behavioral changes, depression, psychosis, drowsiness, amnesia, and visual field contraction. Mean you can't focus on one point. So the motor disturbance may be occurred in agitation in the children's. Another anti-epileptic agent that is called thiagabine. So this is recently developed anticonvulsant potentiate. The mechanism of action of thiagabines actually that is it can potentiate the gamma aminobutyric acid mediated neuronal inhibitions by depressing the GABA transporters, and through GAT1, which remove the synaptically released GABA into the neurons and glial cells. The clinical indication or clinical uses of the thiagabine, it can uses, you can say, in the treatment of partial seizure with or without secondary generalizations. The adverse effects which are reported of thiagabine, that is mild sedation, nervousness, asthenia, and amnesia, loss of memories, and you can say abdominal pain may be occurs. They are reported. Now look at here, these are the different doses, characteristics of the major anti-epileptic drugs. Look at here, this is the name of the drug. Total milligram per day, usual schedule is therapeutic range, and microgram per ml, and a prominent side effect and other effects and other issue which are reported here. So carbamazepine, so they are available at the dose of 400 to 1600. So 1600 you can say per day, usual, and milligram. So it means 400 to 1600 milligram BD twice a day, and the therapeutic range is 4 to 12. And it is prominent. The prominent side effects which are reported, that is diplopia, fatigue, and hyponatremia, which I have already discussed. Other effects are mood stabilizers, and you can say the other issue, that is enzyme inducers. Carbamazepine is enzyme inducer agent. Ethusuximide, this is another anti-epileptic drug which is available in a markets, especially easily at the dose of 750 to 1250 milligrams BD twice a day, 40 to 100. This is the therapeutic range, and the side effects which are reported, that is ataxia and lethargy. So other effect they are also reported, that is skin rashes, bone marrow suppression maybe occurs. Gabapentin is available in at the dose of 600 to 6000, you can say milligram to 12. So this is the therapeutic range, and the prominent side effects which are reported in the form of fatigues and the other effects of treatment of pain, no drug interaction they are reported. Lemotrigine is another anti-epileptic agent which is available at the doses of 100 to 600 milligram BD, 4 to 18. This is the normal therapeutic range. Insomnia, headache, and tremor and anxiety, these are the prominent side effects which are reported. Other effects maybe mood stabilizer agents. Other issue, there may be a risk for the Stevens-Johnson syndrome for slow startup. Another drug that is called levetiracetam, that is available at the dose of 500 to 3000 milligram, 3 to 63 is therapeutic range. Mood changes, irritability, lethargy, which I have already discussed, no drug interaction they are reported. Carbamazepines, so they are available at the dose of 300 to 2400. You can say milligram, 3 times a day, 6 to 40. This is the therapeutic range. Diplopia, maybe diplopia, hyponatremia, and sedation. These are the prominent side effects. The other effects are mood stabilizer. Phenobarbital, they are also this drug is available in a market, so at a dose of 60 to 240. So you can say hertz. 15 to 40, this is the therapeutic range. Fatigue, depression, sedation, they are reported. These are the prominent side effects. Other effects, there also you can say joint pain may be occur, and actually phenobarbital is enzyme induced agent. Then Phenytoin is available at a dose of 200 to 600 milligram. Topiramate is available in 50 to 60 milligrams. Valproate is available at the dose of 500 to, you can say, 600 or so TDS. And Ethusuximide, this is another agent which is available at the dose of 100 to 600. So it depends upon all these drugs. They are available in a market. While some drugs they are not available, they are still under investigation. And these are the prominent, you can say, these are the these are the prominent side effects which I have already talked about in the lecture. That what are the prominent side effects which are reported. So kindly review all these things. They are very important for you people. Topiramate, the prominent side effects which are reported of topiramate, that is in the form of anorexia, weight loss, kidney stones, sleep disturbance, speech disturbance, and distal paresthesia. So headache, prophylaxis, and mood stabilizers. Weight gain, hair loss, and tremor, they are reported. These are the prominent side effect of valproic acid, or you can say sodium valproate. So and this is the end of the lecture. This is the reference. You can study all these material in Lippincotts Illustrated Pharmacology 6th edition, page 157-168, Essential of Medical Pharmacology 7th edition by KP. So thank you so much for watching my lecture. So if you have any question regarding my lecture, so you can ask me. So I am always available for your services. Thank you so much.